What are some strategies for discussing diet and nutrition with patients?
We know that there are certain components of lifestyle and certain medical treatments that are available. And I think this really begs the question, how do you introduce those and at what time? And how do you do that in a way that you're likely to have the best results? So there's a lot of data that shows that a 5 to 10% weight modulation from baseline leads a person to have better health outcomes. So 5 to 10% weight reduction. That can help on the prevention end. You know, a person who's at risk for diabetes, for example, loses that amount of weight, their likelihood of developing diabetes goes way down. The lipids go way down, for example. So for people who are kind of at risk, and for people who already have conditions related to obesity, that level of weight loss is also an effective level at reducing most risks. And the risks related to obesity are vast. We see coronary artery disease, obviously diabetes and its outcomes, kidney disease, cancer, pulmonary disease. It's incredible how much is related to obesity. So now we're kind of getting into the tactics. So how do you have conversations with people about this? And I think most practicing clinicians will identify that it is not just about, you know, how do we look at your weight management in terms of, you know, here's something to do. Here's a checklist, you know, do this or do a food record, come back. Those are really important insights. And so the way that we think about this and what we do, again, at Catasys, is we look at the total perspective of what's going on in a person's life, what they're thinking about in terms of their health, if they're ready to set goals that are important to them and how we align with those goals. And then we get information over time. And this is a practice that I would suggest could be incorporated anywhere. It's what we do, and we do it over a year's time so we can get really intensive with it. But I think this can be incorporated into medical practice as well, is really understanding all of the drivers and kind of where that person who does have the condition of obesity is with their health. So understanding the social drivers, understanding what a person's behaviors are, understanding what their medical issues are, but really also understanding what's going on in their life, where their health fits into their life, what experiences they've had before with weight management that have worked or haven't worked, and then a huge interplay with behavioral health as well. There's a very, very tight linkage between behavioral health conditions and obesity. And it probably goes back and forth. They influence each other. We absolutely have to be looking at anxiety, depression, the type of eating, you know, binge eating, those sort of things and habits as part of this in order to fully address it. So just like we are thinking now about substance use disorder, where it's, you know, taking a full history, being really comprehensive, thinking about all of the different dynamics, and then creating an individualized plan, that's really where we need to go now with these, you know, with people who are struggling with this. It's a really, really difficult problem. So it's longitudinal comprehensive efforts that do include lifestyle and behaviors. That's really the cornerstone. Some of that includes what you eat and how you are getting your food and those social aspects we talked about before. And then some opportunity for medical management as well, which may include, for example, treatments and weight reduction surgery. You cannot get to those other things, like a person who's really appropriate for surgical intervention, for example. You can't go straight to that without addressing the lifestyle issues, the other things that maintain, you know, a person's weight aside from that. And that also includes the behavioral health. And that's why we have a holistic approach to doing that.